The panelists feel support and energy from the government is enough. Is there a sense of urgency being met when they seek resources and support?
No, I don't think so. I think that, in British Columbia in April of last year, the Chief Medical Officer of Health and the Minister of Health declared a public health emergency. That was an outward demonstration of how serious they recognize this problem to be. It needs to be followed up with some very definitive actions, which I think are, underway in some provinces. But the refusal to declare a public health emergency in Alberta, I think, is problematic because our governments have unfortunately demonstrated that in spite of the best efforts that they're putting forward, the problem is getting worse. And public health emergency declarations are available to us to assign extraordinary resources when the ordinary resources and measures fail. They've failed, and they continue to fail. When we're losing one person from fentanyl alone every 18 or 19 hours in this province, and when there are ripple effects to families, to emergency departments, to morgues, to every aspect of social endeavor that you can think of, no, there's not been a demonstration that we care about this problem. I mean, it strikes me that today we sent our kids out the door to school in pink t-shirts because it's National Anti-Bullying Day. And what we told them is this is about being respectful of people's differences and having compassion for people who are struggling with stuff, being there for folks. But on the other hand, in our policy jobs and in our healthcare jobs and in government jobs, we are sometimes indifferent when we don't identify with the situation. So as Petra said, there are so many decisions we make about personal health behaviors that result in chronic diseases and such. We build entire institutes and hospitals and research infrastructure to support, cardiovascular conditions that oftentimes have a lot to do with what we did to ourselves. Of course I wish that nobody used substances. Just like I wish that everybody exercised and everybody ate fruits and vegetables and nobody bungee jumped. But that would make for a pretty bland society. And our job is to be there for people regardless of what decisions they made about their own life when it affects only them. And that's not just a philosophical position, that's also a practical position. Societies that do that and healthcare systems that do that have people with longer lives who are more productive, and we save money in our healthcare system and outside of it. So to me, for us to commit resources to this problem will ultimately save us money and be reflective of Canadian values.